Historically, when patients had tumors inside the nose, they would have to get these very drastic incisions, literally cutting through the skin of the face and lifting the skin off to come down on top of it from the outside. I did a really interesting case the other day, which was an endoscopic medial maxillectomy, where I removed an inverting papilloma in its entirety, which is a pre-cancerous lesion. About 10% of these can go on to turn into squamous cell cancers. And I did it all through the nose, completely removing the tumor. And I have some images of what it looked like before and what it looked like after, and some CT images that we'll go through to know that we've removed this potentially cancerous lesion from the inside of a patient's nose, really cosmetically completely not altering the way that their face looks at all, is really a huge advance in the field of surgery. So what we're looking at here is the CT scan of the patient with the inverting papilloma, and you can see the sinus here, which is underneath the right eye, which is completely filled, versus this other side, which is completely normal. So you can see the inverting papilloma is completely filling the sinus. It's going all the way up to the edges of the bone, and it's actually extending out of the sinus cavity into the nasal cavity. And so what's important to notice here is that there doesn't seem to be any bone destruction, really more just kind of pushing, maybe a little bit of erosion. And the bony architecture is pretty well preserved, but it's really filling the entire sinus cavity and goes all the way back to right about there. So our job during the surgery is to basically go in and just completely clean all the contents of this cavity out, including all the mucosa lining the sinus. And that way we can be sure that this is completely gone.